Hello everyone, I'm Dr. Richard Nagy, President of the California Dental Association. I want to start by addressing how challenging the last several weeks have been for all of us on so many levels. I think we are near the end of our sensibilities, and this is the time we need to be working together to create a strong future for dentistry and for all of us individually. CDA is not a regulatory lawmaking or policing body. Our mission is to support you, our member, in your practice and service to the public through innovation in education, advocacy, and related programs. This is what we do, and we've always done it well. Back in March, we were informed by the experts that an unknown airborne virus affecting the public's health was heading to California, and the projections for infection rate and deaths were quite high, which led CDA to advise only seeing dental emergency patients in order to be responsible, safe, and save PPE for the frontline healthcare workers. Soon after, Governor Newsom ordered all Californians to stay at home in order to flatten the COVID-19 transmission curve, which currently it has. Dentistry is essential and important to overall health. We are not the only healthcare providers affected. All non-emergency medical services such as plastic surgery, elective medical exams and procedures, whether in a practice or a hospital, were also affected. Ultimately, all of healthcare has been deeply impacted by these stay-at-home orders unless care was COVID-19 related. Importantly, these impacts are being felt in every state in this country and around the world. That means unless you were an emergency room physician or nurse, you likely saw your patient base reduced close to zero. It is now time for us to all move forward. Get prepared to go back to our offices and treat our patients' dental needs. In the interim, we have worked to assemble a better understanding of the public health orders and produce a comprehensive set of tools for restarting routine practice, which can be found at cda.org. This brings me to some very positive news. The state of California today issued very clear guidance on restarting routine practice. CDA member dentists and staff have been deeply engaged with the state dental director to ensure this guide is clear, accurate, and easy to follow. The state guidance lays out specific criteria around local infection rates, PPE requirements, COVID-19 screenings for patients, infection control clarification from the CDC, among other topics. This is not a green light to go back to work, but rather a yellow light, moving forward with caution. The restarting of our routine practices will be slow going at first, particularly because of the lack of PPE in the entire international manufacturing and supply system. However, we now have a solid and clear foundation to work from. I deeply appreciate all of your continued feedback. Thank you, and stay safe.